Hello, this is Dr. Barr, and today I'll be discussing testosterone, one of my favorite hormones for our men's health clinic. The next video will be playing how testosterone is working in our environment. So, this current slide is available online and it's courtesy of Trade Medic, and it's a nice cartoon to show us how testosterone target tissues and the impact on different tissues in our body. Now the third slide here is cartoon or diagram showing us that how testosterone is created in our body. The cholesterol molecule, what everybody tells you you need to reduce your cholesterol, is an important molecule that creates your sex hormones. And there are multiple enzymatic reactions that end up creating testosterone. One of the precursors of testosterone that I love, and I always make sure we have good levels in our body, is the DHEA, dihydroepiandrosterone. And then you see that is a quick step to create testosterone. And then from testosterone, again, if we're having high levels of testosterone, can be converted to estrogen. So that's a cautionary note. When somebody is taking testosterone, you want to make sure you're taking the right doses depending on your health status. And this is the next slide showing us how the testosterone declines with aging. Unfortunately, it can start as early as 30 years decline in testosterone levels. We do measure the labs. It's a blood test, and we like to do that test in the morning because that's the highest level in a male productive stage. Normally testosterone, it rises up early in the morning. So if you're drawing your labs, preferably you do it in the morning. That's why men have early morning erections. And by the way, these are the early ones to be lost when we have low levels. So here in the diagram, we see that by 50, we're almost having a completely, almost like 50% of the testosterone is declining. And that is hand in hand with aging. So my preferred levels, depending on the levels, normals in the lab, we usually like to keep our men at 650. That is the protective levels based on clinical studies. So 650 is the number that is my target to protect the heart, the brain, the muscles, and the bone. The next slide here, we are looking at sex hormone binding globulin. And we do measure multiple ingredients that are available in your body of testosterone. So not only a total testosterone is measured, we like to measure the free testosterone, the amount in your body that is circulating and doing its function. Of course, unfortunately, it could be robbed by a molecule called sex hormone binding globulin that also works on other hormones. So it binds very tightly to testosterone as well as other hormones. And depending on that level, you might have a good amount of testosterone as a total level. However, your free or your bioavailable testosterone is very low. And this is the things that we work on by measuring other hormones in your body as sex hormone binding globulin. And this is a cartoon showing that sex hormone binding globulin can increase with aging or decrease with aging, depends on our situation, because other factors can reduce sex hormone binding globulin, which means also we don't have a carrying globulin as well. So aging creates increased sex binding globulin, liver problems that can happen also with drinking, thyroid problems. That's why we check your thyroid when you come in to test your hormone levels. Estrogen high levels also increase sex hormone binding globulin. Overweight, unfortunately, and fat metabolism as the triglycerides in your blood. Of course, chronic inflammation, one of our biggest enemies in the clinic here. Chronic inflammation that happens due to environmental factors now. We know that also increases sex hormone binding globulin. So all these should be managed. Yes, we manage aging as well, to help you reduce the amount of sex hormone binding globulin and hence increasing your own testosterone that's available. So common causes of low testosterone here, plastics is one of our biggest enemies. Plastics are xenoestrogens. They are hormone disruptors. They lower testosterone by competing at the receptor level. Another factor is your increased in aromatase enzyme, which again, can be available in adipose tissue. So somebody with extra fat tissue can increase the conversion of testosterone through the aromatase and making it an estrogen molecule. Of course, sleep is a very important thing. So sleep, the second phase of sleep or the deep sleep, is very important, as well as cortisol levels. So cortisol level increase with stress. All these factors can lower our testosterone. Cortisol and stress are very important. We measure gonadotropin inhibiting hormone. Other factors are vitamins deficiency, as vitamin E, C, selenium, choline. So we measure all these and we make sure that your kidney is working fine when you come and see us. So of course, zinc is important in creating the testosterone as well in our body. So we measure these dietary factors when we check your labs. Cautionary here, alcohol consumption, everybody knows when they drink too much, it doesn't help our erections. Sexuality and decreased libido is also a big factor when we have an issue with drinking. What hormones can increase testosterone? And that is a very important question. As I mentioned before, my favorite hormone that is like almost a step before creating testosterone is the DHEA. It's an anabolic steroid. Yes, it is an anabolic steroid, meaning like it builds muscles. It's a builder. It's naturally produced in our body, and it declines with aging as well, maybe as early as the 20s. So we want to be measuring this and optimizing it. I have my TRX favorite supplement that I've created in the office that also has a hormone, the DHEA hormone, and it helps increasing the amount of testosterone. So that's my first step in men's health. I try to give them TRX to see if we can increase your natural testosterone naturally through the precursor. Here are some foods. Yes, amazing. Salmon. Everybody knows that eggs are good, so a couple of eggs in the morning. Avocados are good for you. Other foods are also important because they provide us with the things that we need to create the testosterone. So vitamin D is very important. So everybody's in vitamin D in my clinic. Vitamin C, E, in a multivitamins with vitamin B6, folate. Zinc is a mineral that is very important, as well as magnesium and carnitine. So we measure and we supplement and we balance. We make sure everybody has enough. So is testosterone safe? That's a very important question. Yes, there's so many clinical studies here. A lot of people ask me, does it cause cancer, prostate cancer? There's so many studies now that we know. This is courtesy of National HRT. Testosterone is very important for health, for heart health, for blood circulation, for brain focus and sharpness and leadership and mood is very important. So we also know that testosterone is important for our sexual function. So there's so many things that we need testosterone for. It's available in so many receptors. We have so many receptors that respond to testosterone. So when we provide our patients with testosterone through supplementation, we make sure they are getting physiologic levels, nothing superhuman as some people do, and that's pretty safe, as well as like showing in multiple clinical studies here. So some studies have shown at this point there is no risk for prostate cancer. So TRT is a program that we provide for our patients in men's clinic. And a lot of people, when they come in, they say, okay, I'm going to go on it. How long do I need to stay on testosterone? And that is a very interesting question because if the testosterone is low and we're not producing it, do you think we can be on it for a long time or indefinitely? The answer is yes, as long as you're taking physiologic and safe dosage and you are being monitored with a physician. It's very safe. It will help you reach your peak performance without risk factors. That's why you need to be monitored by a doctor. You cannot get it online. It's a controlled substance actually, so you got to be very careful where you get your testosterone from. So how long you can be on it? Indefinitely, as much as you want to be on it. I say if you're deficient in iron or protein, you take that on a daily basis. So I think that is the answer. So how do we provide you with testosterone is depending on the consult, how it goes. We talk to you, we see what is the best way of providing you with this treatment. So some people prefer creams. I worry sometimes about creams for absorption or being transferred to a female or a child in the house. It is available also nasal spray, injections, and pellets. A lot of my patients are on injections. They're very small doses that you take every day. I like the physiologic way of replacing your testosterone using physiologic doses, and we monitor it by having your morning erections coming back. When when we talk to patients, we always get this question as well: how can I start, and can I stop it when I want to? So people can start testosterone as long as we draw their labs and see that their levels are low, and we check the other hormones, see why the deficiency is happening. We see if there's any reason why it's being stolen or robbed, like the sex hormone binding globulin, and if it's free, bioavailable, and how all the other supplements and ingredients that help you create your own testosterone are available. Then once we draw the labs and if the levels are low, we can start safely testosterone. And I say you can stop at any time. Preferably, you can be also monitored when you stop it, and as well as making sure that if you're having any withdrawal, if you were on a higher dose, definitely need to be under medical supervision. So most of our patients, they can stop at any time because we're using physiological doses. Thank you so much for tuning in and listening. Please subscribe to my YouTube channel. If you're interested, please send me questions on the comment section. If you would like to reach us for a consult, we'll be happy to help you with your checking your labs and seeing what your levels are. That's the first step. So you can call us at 949-706-1212. This is our website, drbarx.com. Thank you so much, and hope to hear from you soon.